reason I decided to study midwifery is because I wanted to be part of one of the most special and most important times of a woman's life.
The academic staff here are absolutely fantastic, extremely knowledgeable but also really approachable. I don't think I've ever gone not asking a question because I felt stupid or silly to ask. They're always willing to give the help.
In order to make sure that the courses for the students are inspiring, we really evaluate what the students say about the courses and take this on board whenever we're developing new ones.
Very often we will get emails and acknowledgements of how well our students are performing in practice, and these are indirectly coming from parents, childbearing women and their families themselves, which is a really great commendation about the quality of students we are preparing.
So we're working together to ensure that the midwives that we produce are really ready for the 21st century.
The midwifery skill sessions that we hold are extremely practical, which really suits me well. We have a lot of dolls and stimulation that we use. We also practice certain things on each other, like our blood pressures and our vital signs.
What I find rewarding about midwifery is the fact that we support women through all the stages of their pregnancy, and the fact that at the end of the day they turn around and like, Marigold, I'll never forget you.
I chose to do midwifery because I wanted to provide a service for people to empower women and their families to have the birth and pregnancy and experience that they want.
When you come to Kingston and St George's, GCP is your general clinical placement, which takes us for a few weeks, about 7 weeks, to the main side of the hospital, where we'll be working with people who aren't pregnant. So it could be in a stroke ward, renal ward, it could be in recovery, theatre, A&E, and that just exposes us to how the rest of the hospital works. And it also helps us in knowing how to really care for a lady when she's not well. We might have been in placement for like a month. Some of us might have had a really stressful time, so it's nice to see your friends again, since we're not all based at the same hospital. You regroup, and it's really nice to hear about other people's experiences and whether they're similar to yours.
The students can practice their skills that they'll need when they're working out within the wards with patients in a safe environment. The students find it fun and exciting. We have actors in, and it's safe for them to learn how to practice in that area before going out to work with the public.
What makes studying at Kingston and St George's unique is the fact that we are part of 2 universities. So at Kingston, we benefit from the skills labs, which we do a lot of our exams in. We prepare to get ready to go out into practice at Kingston. And then at St George's, we're actually based inside St George's Hospital. The reason I joined the course is the fact that I get to work with women and learn hands-on, and I've worked with amazing mentors who have taught me so much.
Every day, regardless of where you're working in practice, it's always a different day. It's not a routine office job that day in, day out, it's the same routine that you're actually dealing with. Every woman is very different, every situation is very different, and it's exciting, very challenging.
If anyone's considering coming to study midwifery at Kingston and St George's, I'd definitely say do it. It's extremely practical compared to some of the other universities that run the same course. It's challenging, but in a good way. You find a lot out about yourself and you test yourself to your limits, as well as getting all the experience you need to have a career for the rest of your life.